The pre-competitive nature of this, I think it's clear to most people in the industry now that the knowledge management and infrastructures are not the core deliverables of our organizations. We're about developing new medications and drugs to treat disease, not actually building infrastructure and software. And we believe that the lack of an open translation infrastructure and service and the innovation in the analytics is limiting our competitive and pre-competitive translational research activities. The startup costs for a new project, a new collaboration, is always greater because there is no clear mechanism of how you exchange information, how you share information, how you work collectively on a problem, on common data sets. I think another aspect of the pre-competitive nature here is the fact that this is a proven opportunity. The transport platform has been built on an open architecture, and it's already providing support. And this is what's key. We see this as quite a low-risk investment from our side because it's a proven technology. There's 3 IMI projects already adopting this platform, uBioPred, OntoTrack, and Safety. And there's an adoption plan for 4, if not 5, others. But this is now currently being done piecemeal with individual projects standing up the code and managing this. And individuals like Sándor are burning the midnight oil trying to provide support for this, and that's not sustainable. And also, how do we start sharing the code base between these projects? So it's proven. It's also important to note that there's a lot of activity in the US, and Sándor will talk about that later. There's a number of academic medical centers and not-for-profit organizations starting to pick up this platform and run with it and evolve it and change it. And so we'd really like to see this actually coordinate across the EU and the US. And then there's activities like the SAGE Bionetworks Genetic Alliance, the comparator trial, I can't remember what CAP stands for. The clinical trial comparator arm partnership, CTCAP. I always call it CTCAP, which is a number of different pharma and not-for-profit organizations looking to see how we can share our comparator arm components of our clinical trials. And again, what the SAGE Bionetworks is doing there is using Transmart as the base platform, as part of their Synapse platform. But we also recognize there is active activity inside Europe right now. You're seeing a lot of investment coming out of the research infrastructures, and projects like eTRIKS+, BBMRI, Elixir, ECRIN will all have touch points with this project. And so we have discussed this with Anne and the Commission and the fact that they're keen to see these activities join up. And then I think we'll hear in a minute about EMIF. And it's clear that there's touch points there with that project as well. And so this project will not execute in isolation from these other activities. Impact on R&D, as I say, improved efficiency for TR study setup and execution and the analysis of that. I think it will provide the platform to enable translational data sharing and interpretation. So for example, right now there's an active discussion going on amongst the companies about how we share safety data between the companies and academic centers. You know, part of the challenge is just the policies and the IP and the business models that different companies have about sharing information. But there is a more fundamental challenge, is how do you share it? Right now, there is nowhere really to put this information. So at least we can remove one part of the bottleneck for this kind of more opening up and sharing of this information. We also believe that this will enable both internal and other private-public partnership programs and activities. When I say internal, if this should improve the software, it should improve the analytics, it should give us more access to data. If we want to do cross-study analysis, this will give us a body of translational research data which we can plug into and compare with our internal experiments. And so it should give us a much richer picture of what's going on with a lot of our drug programs. Architecture of the project. I didn't know whether to talk about an architecture in software or architecture in work packages, so I've done a bit of both on this slide. What you've got there on the left-hand side in that blue diagram is a really simple architecture picture with the different types of information we're trying to cover here. So you've got the clinical type information, the phenotypic and demographic information, the biochemical data. And then you've got what we're calling here the biomarker data, the CNV, the genetic data, the omic data, and how that needs to be brought together. And then on the right-hand side, it is more the background contextual knowledge, what the pathways, the literature, maybe even getting to some of the epidemiological data, which may plug into some of where EMIF is going. Importantly, we need to bring that information together, typically at a level of individual patient or cohort. And in this picture, we're talking about a single data warehouse. With the actual proposal, I think we may need to think more broadly than that, and about maybe we're looking at federated systems. And importantly, we've got the analytics and the generic search and browse technologies on top. What's key is that we are looking to have this platform standing up very, very early in the project. We've got, as you know, we've got active IMI efficacy and safety projects that need support now. So one of the things we'd be looking for is proposals where this can be stood up on day one or month one. So this is not about doing we're not looking for an extensive build proposal. We're looking for something, looking at opportunities where we can take existing platforms, and we're proposing Transmart and provide the solutions to the need now. The work packages we've broken down into knowledge management services, which is the key work package in this activity. I've put in here about KM platform research. Maybe the research is the wrong word here. What we're looking at here is about how we add different data modalities, maybe change the way the ETL processes work, think about the warehousing, whether it's a single warehouse or federated warehouses. It's looking at the fundamental platform to differentiate from work package 4, which is very much about the research. It's about the different methodologies, the algorithms we can put over this data to draw new insights. And then there's a piece which is work package 3, which is key, and it's about standards research. But it's not just about research, it's about coordination. There's lots and lots of standards in this space because of the diversity of data involved here. And so we would like to see the proposal that come back for this call show how they can connect in with all the other standards bodies that fit into this area. And then we got a piece around governance and business models, and it's important that we need to try and evolve this, which is a 5-year project, into something which is a lot more sustainable. And what is the funding models we need to be thinking about? What is maybe the chargeback models to support various different projects to create some kind of revenue that this actually stands up as a not-for-profit service.